It's great to be back on the demo day stage. Like Chrissy mentioned, we actually went through the Philly program in DreamIt, so it's kind of a great opportunity to be able to come back to Baltimore and introduce ourselves formally to the entire community. There's a lot that drew us back to the city, and it's been a really exciting time for us to base our company here and really grow. Jason wanted me to go through sort of the timeline of our company and where we were 12 months ago, which I thought was really interesting as I was thinking about it, because my co-founder and I were actually still in grad school 12 months ago. Our priorities were totally different. We're probably worrying about finals at this point, so we hadn't really even decided how we're going to continue the technology. But we come from a really cool program at Hopkins called the Center for Bioengineering Innovation and Design, or CBID. It's really unique in that it lets young engineers actually go out in different clinical environments and experience or identify unmet clinical needs. So I got to rotate through cardiothoracic surgical oncology, interventional cardiology as a biomedical engineering student, which I really don't think you see anywhere else in the world. And it's kind of that express purpose of going out and trying to look at these problems from a naive perspective that sets CBID apart from most other grad programs. So after that ended in May of last year, we went straight to DreamIt Health in Philadelphia, where we actually got to put our heads down, work on the technology, and challenge some of the hypotheses that we had developed in school. And I think those two together form a really great team. They're a really great combination. And I hope we'll see more companies sort of follow that path. DreamIt was also a great launch pad for us in terms of fundraising. As soon as the program, like most DreamIt companies, we kicked off a seed round after demo day in November last year. We were really lucky to find a strategic investor early that made the fundraising process quite a bit easier. We are raising it towards the end of this year in November. Jason always says, as an entrepreneur, you're always fundraising. And to be perfectly honest, I didn't believe him the first 10 times he said that. But I totally do now, so I apologize. And I guess one of the other big milestones we hit since we've been back in Baltimore was our first big strategic partnership. So there's this group of clinics down in Florida, actually in about 5 states, called Wound Tech, or Wound Technology Network. It'll be the first time we actually deploy the technology we developed into a large scale and kind of make it openly available to a large set of patients. So I'd like to actually step back and go through the technology in a bit briefly. Tissue analytics is transforming the smartphone into a sophisticated platform for imaging and remotely evaluating chronic wound patients. Now, chronic wounds are typically the byproduct of the frailty associated with either aging or diabetic patients. These patients tend to have a multitude of underlying chronic conditions that actually impairs the body's ability to heal. So these patients end up with these open skin wounds that don't heal for months and often years. And just to put this in perspective, from a study we did at Hopkins last summer, we saw the average wound duration of 23 months. So if you can just imagine that, living with an open sore on your body for almost 2 years. It's crazy, and it's really just sad. And every day these wounds are left open, the patient is increasingly subject to infection, amputation, and death. And one of the big problems in this space, and one of the reasons these wounds are so hard to heal, is there's simply not enough doctors who specialize in wound care. Patients end up being managed by predominantly unspecialized care providers at nursing homes or home care groups. And even when patients can get in to see a doctor, the tools at their disposal are incredibly crude. The state-of-the-art for tracking a wound over time and determining if the treatment's actually working is just a simple ruler. And as you might imagine, this technique is so variable and prone to error, it makes it impossible to see if the wound's actually healing, if the treatment's working. Doctors have to rely, therefore, on sort of guesswork and anecdotes, and there's thousands of different therapies out there that they can choose from, so they really have, have to rely on their experience to determine what treatment's working. So an analogous case we like to draw is actually to radiology. Radiologists used to rely on film images held to a light box. One of the big advances in this field was the shift to digital images. Radiologists now sit in front of these incredibly elaborate workstations with a rich depth of analytical capabilities at their disposal. One specialized radiologist can manage patients from all across the country or all across the world. And that's exactly what we want to be for wound care. But fortunately for wound patients, we don't need to deploy million-dollar MRIs or CT scanners to every nursing home in the country. The solution to this problem is already carried in the pocket of every single nurse when they see patients today. the key insight we had is that we can leverage the camera on the smartphone to deliver the same quality analytics or very high quality level of analytics on the progress of wound healing. So from just a photo acquired on a smartphone, we can sort of cut through all the noise in how we characterize wounds over time. So we can objectively determine the surface area, the tissue composition, the contraction rates. We can give doctors a decimal level understanding of exactly how the wound is changing over time. So our actual product is a mobile app that lets nurses in the field, at these nursing homes, at these home care groups, collect this very high quality data. They then transmit it to our web portal where doctors can view all this analysis and they can hopefully use it to inform their own clinical decision making. That aspect is what we think is most analogous to what radiologists log on to in those PACS workstations. We can leverage the specialized capability of a few providers and let them manage more patients more efficiently. Actually, one of the really interesting aspects when we went through DreamIt was we determined sort of the minimum viable product that we could launch immediately under existing regulations. So we kind of determined how this changing space of mobile medical apps and how we could sort of leverage that to launch immediately and try to build up traction while we collected the data necessary for a regulatory approval. So we have a couple really cool upcoming milestones. The first is this large clinical utility study with Penn Medicine and Independence Blue Cross. So we're actually going to be evaluating on a large scale the economic impact of the system. So we're trying to actually show reductions in hospital readmissions, infection, amputation rates, actually see if we can heal patients faster through this system. And I mentioned this earlier, but we're doing the first large-scale deployment with Wound Tech. They have, they're in about 5 different states, and because they sell their services directly to insurance companies, they have about 20 million lives covered. I just want to close by saying that all the companies you'll hear from today are going to have an ask. Most, I suspect, will be fundraising. Ours is a little bit different. We obviously have a vested interest in increasing access to this technology and getting it out in the hands of as many providers as possible. So we are really looking for contacts at home care groups, skilled nursing facilities, long-term care facilities, hospital outpatient clinics, really anywhere where wounds are treated, we want patients to have access to this technology. So if you have any contacts, I'd love to hear from them. We're definitely going to need your help to increase access to this technology. So thanks very much for the time, and I hope you'll join us for this journey.